Hello! This is like my 5th time filming this, so ignore the mess behind me. We are not an influencer. We are a mom, and my room tends to be the last thing that gets cleaned. So, my name's Katie. I am doing this because I have met lots of people who have polycystic ovary syndrome, or people who want to get on some form of weight loss medication. So I'm filming this because I've had a few phone calls with people and I've talked to some people in my life, and I feel like there's probably a lot of people who want to know a first-hand experience of weight loss medication and polycystic ovary syndrome. So I have a notebook here, but it's not a script or anything. It's just to keep me on track. I have ADHD, so I tend to ramble off into the wilderness and then sometimes find my way back, but the chances are slim. Number one thing I have on here is that I am not a doctor. I am a human person, and I've had polycystic ovary disease since I was I think 15 or 14 is when it started. I've done lots of research. I read all the articles. I look into all the studies. So I feel like I am really well educated in it, but I'm not a doctor. And I've been on Wegovy, which is a form of semaglutide. It's the same thing as Ozempic, for 10 months now. So I've actually lost 60 pounds so far, 62-ish, in the 10 months that I've been on the shot. So, first and foremost, my diagnosis, by the way, off track already, this video is just for me to introduce myself and give a little bit of a rundown on polycystic ovary syndrome and the shot that I'm on and my experience with getting diagnosed and getting on the medication, because that was a hurdle in itself. I want to do another video about how I handle side effects and how I prevent side effects and keeping up with exercise and keeping up with diet and stuff like that, and just go over things in more detail. But this is just me introducing myself and sharing kind of my story, so that if this is the only video you ever see of mine, you get the synopsis here. I have actually been filming since the day I started my shots in April of 2024. So that's going to be a documentary type situation that's going to come out once I get to my goal weight. I'm going to edit that down and post it. So first and foremost, PCOS diagnosis, cyst rupture, hairy nipples. Let's talk about it. I was a freshman in high school. So I started freshman year when I was 14. So I was either 14 or 15 when this happened. I do not know the exact date that it happened, but I was in severe pain one morning getting ready for school. And my mom is a registered nurse, and she thought that I had appendicitis. So she took me to the ER. They also thought that I had appendicitis, but luckily they did an ultrasound and they discovered that it was a cyst on my right ovary. And so I did not need surgery, but it had ruptured. I think it was 5 centimeters. They said it was pretty big. I don't know. I think 5 centimeters, looking at, that's tiny, right? But I guess when it's in your body, that's, really big. They said that they had found, 3 on one side and 4 on the other, and that it was looking polycystic. So we go to my pediatrician to follow up after that, and he says that it cannot be PCOS because I don't have hairy nipples. Now, he didn't look at my nipples, so I guess he just guessed. They're not hairy. The one symptom that I don't have is the hair growth. The people will get facial hair growth on the nipple area. Places where men will grow hair is what people with PCOS get. You have higher testosterone in your body, and that's what causes that. I also struggled with severely poor mental health when I was in high school and elementary school. There was a lot of outside factors that influenced that. My family life wasn't perfect, but I do believe that PCOS really affected that for me more than it would have a normal teenager. Getting diagnosed was a nightmare. They put me on birth control to like prevent more cysts from forming. So from the age of 14, I was on birth control. I was on the pill first, and then I went on the depot shot. And the depot shot is when I started to like gain weight. So I got off the depot shot and went back on the pill, didn't lose any weight. So they told me it couldn't possibly have been from the depot shot, because if it was, then I would have just lost the weight. I got on the IUD, which like rejected itself out of my body. So I was on that for a year before I crawled to the emergency room and was like, please take it out, because it was enough suffering for one person. I got off of birth control because I found a healthcare provider who I do really, really like respect and admire, except for that she told me I would probably be infertile. She said that when I am trying to get pregnant, we can put me straight on fertility medicine and, you know, get me ovulating properly and all of that. I did not ovulate regularly. I was not having periods every month. And when I did, they were like extremely painful, like passing out, throwing up, bleeding out, like enough that I'm lightheaded and just sick, like really just sick when I'm on my period. And that's still kind of true. It has gotten better, but it's still really painful. This healthcare provider that I found, she's the one who ended up diagnosing me finally. I think I was 18 or 19 when the official diagnosis happened. And she put me on, I think, 500 milligrams of metformin and was monitoring my blood sugar and my A1C and all of that. She's also the one who first diagnosed me with insulin resistance, which I had never heard of. But she said that I wasn't quite at the point where I was pre-diabetic, but like we're getting there and we need to like do something now. So she like gave me a list of all the foods that I could eat. And I think that's when I really started researching PCOS, was when I had the official diagnosis. I had kind of like already been researching it because I had like this inkling that I have it. So I was kind of going through like different recipes, different diets like already, because at that point I was like 190 pounds, which at 5 feet tall is considered obese. So, and I was just, you know, hating life, hating myself. So anyway, because she told me that I would struggle so hard to get pregnant, I and my partner made the decision to go off of birth control because, like, what are the chances? And I got a positive pregnancy test, I think 3 or 4 months later. There are some studies that show that, like, PCOS can cause, like, more miscarriages to happen and like bleeding during pregnancy and things like that. So it was very like stress filled the entire time. The first probably like 20 to 30 weeks were really, really like just like me panicking and having anxiety every day. And then plus I was pregnant. I was 3 months pregnant when lockdown happened. So my partner was no longer able to come to my doctor's appointments, and I wasn't even really driving at the time because I had this like huge phobia of driving. So it was really, really hard. He did end up getting to drive me to most of them, but he was not allowed to come in. So that was like, you know, you have your anatomy scan when you're 20 weeks and you're seeing all of the things, and he couldn't come to that, and I wasn't allowed to film it either. So it was like super just hard. My mental health took a nosedive when I like immediately, as soon as I got pregnant. I lost weight at first because I wasn't getting up enough to like get food. I would eat like crackers and that would be all I ate. I wasn't really like throwing up or nauseous or anything. It was just the depression was so bad that I couldn't physically make myself eat food. But that, don't worry, that's like 10 pounds that I lost at first, it like got gained immediately back. I did end up going on antidepressants while I was pregnant. After like long discussing it with my doctor, we decided that it was the best thing for me because I was like unwell. It did end up being like a healthy pregnancy, even though it had its quirks, a healthy labor and delivery. So healthy baby, she's now 4, so that's crazy. And we are discussing the second baby, right? I already had a pap smear scheduled, and I was going to discuss like family planning things with my doctor when I went in for my pap smear with my OB. And they called me probably like a few months before the appointment. I got lots of notice, and they said, your OB is no longer doing like pap smears breast exams. He's only doing pregnancy right now because he was already overbooked when I was going there for pregnancy, but it was like, I was a little bummed about it because I had been seeing the same OB since like I was 14 and like started having issues and needing birth control and all of that. They gave me the name of the new provider and I was like, okay, do I like cancel and find someone else? Like, I didn't do any research on her or anything. I was just like, whatever, I guess one more person's gonna see my punani. It turned out to be like the best thing that could have happened. I had originally gone and seen my primary care doctor. See, this is me getting all over the place. Backtrack, before I see the new provider for the OB's office, I was seeing a like primary care provider. Oh, Sparky! I caught that. I was seeing a primary care provider. She had put me on Topamax and Wellbutrin because those two things combined are supposed to like cause a lot of weight loss or some weight loss. I did lots of research on it. Some people really had like tons of weight loss with it and some had none. I was one of the lucky people who had 0 weight loss while on those 2 medications. I told her that I would like to try semaglutide, and she was like, well, I don't know if your insurance will cover it. So I don't think that conversation ever really went anywhere. It probably would have if I hadn't found this other provider. I walk into the office to go get my pap smear. I'm just like, yeah, so excited. And she just comes in and she's like lightens up the room. She's so like upbeat. She's happy. She's like, I love my patients with PCOS because they respond so well to semaglutide. And I like to, watch them, be so happy. And she said that they cry because it feels like this huge like relief that like they can eat without gaining 10 pounds. Which is an issue. If you have PCOS, you probably are aware, can't eat anything without gaining weight. It's like impossible. She's like, I will put in the prescription for you, but you can't get pregnant this year. And I'm like, okay, well, let me discuss it with my partner because we were, going to start trying. That's part of why we went to the doctor. He came with me to this appointment too. But we're on the way home and we're talking about it and I'm like, I don't know. And he's like, well, your pregnancy was really hard. It was really painful. My joints hurt. I had carpal tunnel. I would get Charlie horses in both legs at the same time. I couldn't get out of the bathtub. I was having so many issues. It was a lot on my body. And so we were talking about that and just how rough it was. And we decided okay, let's put it off one more year. The age gap's not going to be what we wanted, but let's put it off and just try this out and see if it works. I emailed the healthcare provider and I said, I think I'm okay with trying it. Just for however long. And if the side effects are really bad, then I will stop taking it. And I did ask about weight gain, rebound, after you get off the shot. And she was pretty confident that if you wean off of the shot, then you, most people won't, sorry, there's something in my eye. Most people won't gain it back. But she did say with PCOS, sometimes you want to just wean to as low as you can take it and try and stay on it forever. But she said insurance is currently fighting that right now. So, but maybe by the time I need to get off of it, we can make something like that happen. However, you cannot be on it while you're pregnant or breastfeeding. That's a big concern I have, but that's for another video. She asked me to send her a email, which turned out to be a short novel of everything that I'd been through with PCOS. So I did, and she wrote the prior authorization to send into my insurance, and I got approved on the first try. And she had told me, if I don't get approved, she'll make them approve me. She said that she has sent over 17 prior auths for one patient before, and if it's not Wegovy, it will get something else, there's other ones. But, so anyway, they approved Wegovy, so that's what I'm on. It gets approved, the pharmacy calls me, I'm like, okay, how much am I gonna pay? With my insurance, it was $20 for the first 3 boxes, and then all of a sudden it went down to 0, so I don't know what happened there, but I don't pay anything for it right now. So, I don't know. I do the first shot, I'm sitting there terrified, I decided to do it in my thigh, And I've never given myself a shot before. I am okay with needles. Like, I get lots of blood work done. At this point in my healthcare journey, I was going like every other month for blood work because my platelet count was high and my white count was high. And like my iron was low, my D was low. I was on prescription vitamin D. It's a whole thing. So I'm no stranger to needles. Plus I was on the depot shot for a really long time. But doing it to yourself is a little different. You know, now I just like take it and I'm like, shh. But the first time it did take me like a solid 45 minutes sitting there trying to like make myself have the courage to do it. And I did it. That night, I actually noticed a difference. Now that could have been totally a placebo, but I couldn't finish dinner that night, which was like weird for me because normally I'm like, I finish my portion that I've made for myself and then I'm like, I'm still starving. That's not what happened that first night. Second night, kind of same thing. Second day, same thing. My appetite was like really gone and I was just not thinking about food as often. It's just wild. Once the food noise goes away, you realize like how detrimental it's actually been on your brain and your like mental health and your well-being. It's wild. The third night, for whatever reason, is when I started to get the nausea and I did not throw up, but the fourth night I blew chunks. I was so sick. And once I threw up, I was fine, but I'm the type of person that will sit there and not throw up for as long as possible until like it's coming no matter what. So I did it to myself. If I just puked, I would have probably been fine. But I'm like literally sitting like next to the toilet, emailing my healthcare provider, like, can I please get a prescription for Zofran? She sent it and I had it by 8 a.m. the next day, so that was great. The first month was going through quite a bit of Zofran. I was very nauseous. I was very fatigued. I was still trying so hard to keep up with like at least 10,000 steps a day. My diet was already really clean, which is one reason like PCOS makes you want to just like find whoever owns PCOS and just beat them. Because you can be doing everything right and still not lose weight, or at least in my experience. So I was eating the same, definitely smaller portions, but still like it started to become like a fight to get enough calories in the day instead of like making sure we stop at a certain point. It was like make sure we get to a certain point at least. We don't want to be under, however many. And it started to become a struggle to get to the 10,000 steps a day. I was not able to do it every single day. There was lots of days where I was sleeping. So at my first follow-up appointment, I mentioned that and the nausea, and so we decided to stay on the low dose for another month. And I was a little bummed about it because everyone that not everyone, but I'd read a lot of posts about people on Wegovy who don't get a lot of weight loss the first 4 doses until you get to the high 2 doses, which are the therapeutic dose. So I was in kind of a rush to get to the highest dose. Looking back on it, I was losing weight on the lowest dose. I wish that I had stayed on the lowest dose until it stopped working and then went up again, because now that I've been on 2.4 for 4 or 5 months, I don't even know, I'm starting to feel like it's not as effective. Still works and everything, don't get me wrong, but it feels like just a little bit harder to keep up with the diet and the exercise and stuff like that, just because the food noise is kind of there. It's not quite as bad. It's definitely silenter. I would recommend if you could stay on the lower ones for as long as you can, then do that. I had to stop taking metformin and I had to stop taking regular vitamins and switch to gummies because for whatever reason my vitamins were making me puke, so I switched to gummies and now I don't get nauseous anymore. Metformin was making me puke too. You can safely be on both the Wegovy and the metformin. It's just not for me. Maybe now I could probably get back on metformin. So when I do the shots at night, because I started doing that because I thought maybe that would help with the nausea, I for some reason wake up at 2 a.m. in a full-blown panic attack. And I mean, the correlation is there. It's not causation or whatever. I don't know if the Wegovy is causing this to happen, but every night that I do my shot, I was waking up with anxiety. So last week I actually went back to doing it in the morning and I'm good. No night anxiety at all. Again, placebos, brains, weird things, I don't know. Periods now. My periods are relatively normal now. I will say I did get back on birth control because I was so scared of getting pregnant on the shot that I figured it was worth the mental health, like, saving grace to get back on birth control. So I'm on, like, not the lowest dose, but, like, the second lowest dose of the pill, and it's been great. Now, I did try to do the thing where you skip the placebo pills and go straight into the next pack, and every time I do that, I bleed for, like, 30 straight days. So I don't know what that's about. Like, I'll stop for a week and start bleeding again. It's really bad. So I quit skipping the placebo pills, and so I just have the placebo period, basically. And that period it's a withdrawal bleed from not taking the hormones anymore, so it's not the same as a period. So they're less painful, they're less bloody, they're less chunky, they're less, you know, throwing up, passing out. I do still get some pretty bad cramps, but, like, I have prescription medication to take with my periods because of how painful they get, and I haven't had to take a single one since I started the birth control again. So I know a lot of people are against birth control for PCOS, but it really does help with the pain, at least for me. So as I mentioned, I had high platelets, white count, iron was low, my blood work was just kind of all over the place. I ended up needing to be seen by a blood doctor. What are they called? They're like professionals in blood. He's also an oncologist, so that was a little terrifying when they referred me to him. When I first came in, he was like, you have the markers of an inflammatory disease like PCOS. And I'm like, you don't say, because I actually do have PCOS. So it makes sense that my blood is inflamed because the rest of me is inflamed. He was like, yeah, just keep losing weight, girl, and like we'll get this normal, it'll be fine. And I'm like, okay. I was already on Wegovy at the time, but I had only lost like 10 pounds. It was like the first like 2 months of being on it. My last appointment with him was in, I think, November of last year, a few months ago. And my platelets are normal, my white count's normal, all the things that were high are normal, except that I tested positive for mono. Just the markers that I've had mono like sometime in the past, I don't know. They were checking me for like lupus and all sorts of like autoimmune diseases too, which all thankfully came back negative. So my main issue is just PCOS. He was like, let's go through your blood work and look at this, and you'll see that this is the first time that you scratch. Sorry, I have a lot of animals. This is the first time that your blood work has been normal in like 10 years, which is wild. And he fired me as a patient. He said, don't come back unless this shit starts going up again, basically. And I was like, cool. So now my regular like primary care provider takes care of the blood work, as well as my OB provider. She also does there's still lots of blood work that happens. It's just less often now. I already mentioned in the beginning that I've been documenting this entire journey. So eventually a video will come out about like my experience and the things that like in real time, like I've filmed everything. Just the joys of, you know, losing weight after trying for so long, and the struggles that have come along with it. I've filmed pretty much everything. There's lots of me crying. There's lots of like getting mad at healthcare systems, and you know. So anyway, I do still have about 40-ish pounds to go. I don't want to give like a specific number because I don't know. But I do want to get pregnant this year still, so I'm trying to like kick my ass into gear and like really start like losing a little bit faster. 60 pounds in 10 months is great. That is such good progress, especially like for me after trying for so long and getting nowhere. Hi. Do you want to move? I don't even know what I'm saying, but yeah, so 40-ish more pounds. Here's me before. I'm gonna put it somewhere. This is me now. Hi. I want to do like a bunch of different videos about like Wegovy, semaglutide. Those are the only ones that I've been on personally. I could do a couple videos about Topamax and Wellbutrin because those messed me up pretty bad. That's my introduction. Been 60 pounds down. Still going for more. So if you have found this video, you probably do have PCOS, or you think you do. Leave me questions. I would love to answer questions, like just based on my experience. Again, I'm not a doctor. Sorry, I've been talking for 30 minutes and like I got a frog in my throat. But yeah, that's all I have for now. I'm gonna go edit this and upload it. I'm really excited for like this journey and like finally bringing people into it. I wasn't going to upload till I was at my goal weight, but I'm at a point where I feel comfortable doing it, so here we are. Yeah, so that is all, and I will hopefully be back next week.